Good evening, everyone. Thank you, madam, for the kind introduction, and I'll get started. So, by the time they get the slides on, yeah. So, novel glucagon formulations changing the landscape of severe hypoglycemia treatment. Very interesting topic when I got this. Not a very common drug that we use, not a very common drug we are able to use or prescribe in our patients. Occasionally, we get patients using this. So, hypoglycemia, of course, can happen in our type 1 as well as type 2 diabetes patients. Complications associated with hypoglycemia, we all know it can affect quality of life, it can cause cardiovascular events very importantly, cognitive decline, and it can also lead to death. So classification level 1 less than 70 milligrams, level 2 less than 54, level 3 was severe hypoglycemia where by definition patient requires a third party assistance for treatment and it may progress to loss of consciousness, seizure, coma and death. So treatment, simple rule of 15, we know this, blood glucose less than 70 or even, nowadays lot of people use CGM. They'll say, sir, on CGM I'm looking at 100, but I'm feeling busy. I cross-check with my glucometer and glucose is 79 or 75. So that discrepancy may be there. We all know there is some difference in the CGM because they're checking the interstitial glucose, capillary glucose, venous glucose, there will be difference. So many times we tell our patients to go clinically also if they're having symptoms. We want them to treat it. So 15 to 20 gram of glucose, check glucose levels after 15 minutes. And if the blood glucose is still low or if the patient still has symptoms, repeat this procedure. And once the patient is better, the glucose level should up, ask them to take a snack, some carbohydrate or snack so that the glucose levels can stabilize. So now that is where the glucagon use comes into play. After the 15-15 rule, if the glucose levels still remain less than 70 or symptoms of hypoglycemia persist, then we may need to use glucagon. Of course, if the patient is at home, they may need to call the ambulance by the local number. And then, of course, if the patient improves, have a meal or snack to prevent recurrence. Some patients will not respond to the rule of 15 and some patients with less than glucose less than 40 will progress to level 3 hypoglycemia, which is coma, seizure or unconsciousness. And we need to be prepared with glucagon. So glucagon, of course, is like insulin is made in the pancreas. It's secreted from the alpha cells of the pancreas. It's safe and relatively free from adverse effects. No human overdose has been reported and it may cause nausea and vomiting. So how does it act? First of all, it has been approved by the US FDA for the treatment of severe hypoglycemia. It binds to the G-coupled receptors on cells throughout the body, mainly in the liver, GI tract, and pancreas. Activates an enzyme called adenylate cyclase, which increases cyclic AMP levels. And this process stimulates the breakdown of glycogen and production of glucose, mostly from the liver's glycogen stores. So this is an important slide here. It basically explains everything what I'm going to talk about today. So hypoglycemia, looking here actually. So low blood glucose, treating with glucagon. So these are the various forms available in which glucagon is available. It could be an injection which needs to be formulated. It comes in the form of powder. I'll discuss that in the next slides. Auto injections are available. Nasal delivery of glucagon is also available. Microneedles, these are more in the research and the pump is also in the research stage. So what happens is when the alpha cells secrete glucagon, if it is injected, it goes to the liver releases glucose into the blood, which normalizes the blood glucose levels. So glucagon emergency kit, it's available in a package with supplies needed for administration. It contains a bottle of glucagon in the powder form. It needs to be reconstituted. The reason is it is not stable at that pH if it is already reconstituted. So this is the older one, which is still the most common one. In fact, before coming here, I checked with the pharmacy in one or two pharmacies in Mumbai that what glucagon is available with you. They send me a photo. I ask them what is it. So it is in the powder form only still. There are some hypopens available, which once I had a patient from Middle East, they type 1 patient traveling from Mumbai and their glucagon was exhausted. So I had to actually search with Novo and NIL people and arrange a pen for him. So, it took 2 to 3 months to arrange the pen. So it's not so commonly available in our country, not so commonly used. So this is the one which was easily available. It's a form of a powder. It needs to be reconstituted and the syringe you have to specially dilute it and it's obtained by prescription for diabetes patients. So what is the limitations of this kit? First of all, we are talking about an emergency. If, I'm type 1 and I have hypoglycemia. You ask me to take this powder, mix a fixed amount of diluting fluid. add it, mix it, then again withdraw the particular dose, and then inject myself. In emergency, this may not be the ideal thing. This was, even if a relative is available, again, when there's a panic at home, if somebody is having hypoglycemia, it may not be the ideal thing. But this was the commonest thing which was available till now. Nowadays, we do have some other better options. So commercial kits require reconstitution, multi-step preparation can lead to errors or delays, and non-medical users will require training. Every formulation has its limitation, and what seems impossible today could be tomorrow's breakthrough. So various organizations also available also recommend glucagon that do not have to be reconstituted, which are easy to inject. So what are the novel glucagon formulations now? So these new formulations aim to improve the ease of use, effectiveness, and safety for treating hypoglycemia. And these are newer delivery methods, more stable formulations, and easy to administer devices. So first of all, glucagon nasal spray. It's called as Baxi, developed by Eli Lilly, and it's the first intranasal glucagon approved by the FDA for emergency treatment of severe hypoglycemia. Glucagon is absorbed to the mucous membrane in the nose, allowing for rapid entry into the bloodstream. Provides a non-invasive alternative to glucagon injections, easy to administer, especially in emergency situations. No need for injection. Provides quick and effective rise in blood glucose levels. Only issue is if the patient has nasal congestion or other issues, it may not be the ideal form of therapy then. Stable, ready-to-use glucagon injections. Product example, Gvoke. So developed by Xeris Pharmaceuticals. So it's a liquid glucagon which comes in a pre-filled, ready-to-use syringe or even an auto-injector. Auto-injector, which means nowadays we have these, say, dilute injections, which, even you can't even see the needle. You just need to lock and lock and inject. You'll get a sound, the needle comes out, it gets injected and goes in. So this is probably very ideal for patients, even for those who have needle phobia, even for relatives, because you will not be seeing the needle in the process. So auto injections are available, delivered subcutaneously or intramuscularly. Easy to use in emergencies as formulation is already in liquid form. You don't need to reconstitute like the previous one and does not require mixing. It is stable at room temperature, more convenient to store and carry, and can be administered by relatives or even the patient themselves. So this is also an auto-injector, glucagon emergency kit, Zegalog. So similar to Gvoke, ready-to-use injectable solution, delivers a pre-measured dose of glucagon. So the dose is also fixed there. When you reconstitute, you have to look at the dose, depending on the weight, it's type 1, type 2, how low the glucose levels are, pediatric or adult. Here you don't need to worry about the dose also. It's an auto-injection. Microneedle patches. So this is an emerging technology. Research has been conducted on microneedles that can be administered glucagon transdermally through the skin. And these patches would be small, painless, and could potentially provide continuous glucagon delivery or be used for emergency situations. And long-acting delivery systems. So there is ongoing research in developing long-acting glucagon formulations which can be more stable and can be used both in type 1 and type 2. So this is the summary of different glucagon formulations which I have discussed. Sorry, I think we are not able to read there, but these were the which we've already discussed. One more is a combination therapy which is under research again. So here they are trying to combine insulin as well as glucagon. So glucagon insulin co-therapy products, and they can be as a closed loop like artificial pancreas which we are using. So the use of CGM with the insulin pump with the glucagon pump. So which can, if the glucose goes down, automatically the glucagon comes into play. If the glucose goes up, automatically the insulin comes into play, and so on. 4 new categories of glucagon. So these are liquid stable glucagons which are available. Basic glucagon, biochaperone glucagon, non-aqueous soluble glucagon, and intranasal, which we have discussed. And basic glucagon. So these are all comparing the first one showing basic glucagon at different doses on the left. Then biochaperone glucagon, 1 milligram and 2 milligram. Non-aqueous soluble glucagon and intranasal glucagon, 1 milligram, and compared to glucogen 1 milligram. Intranasal, the dose is 3 milligrams. Basic glucagon is a human glucagon analog with 7 amino acid substitutions and improving stability and reducing fibril formulation in aqueous solutions. It can be used in type 1 patients, and it has longer half-life, approximately 30 minutes. And median recovery time of 10 minutes, significantly faster than placebo. And 99% of the participants achieve plasma glucose recovery within 15 minutes, compared to 2% with placebo. Biochaperone glucagon is also a stable, ready to inject aqueous formulation of human glucagon for hypoglycemia rescue therapy. And it is quickly restored approximately plasma glucose of more than 70 after hypoglycemia. Non-aqueous soluble glucagon used in G-pump and G-pen mini as an aprotic solvent strategy. Concentrations up to 5 milligram per ml offers stability up to 2 years. And dose administration is weight dependent for pediatric patients aged 2 to 12 years. And for those less than 45 kilograms, the dose is 0.5. More than 45 for most of our adult patients, the dose is 1 milligram. Intranasal glucagon, it has a fixed dose of 3 milligram for the treatment of severe hypoglycemia in individuals who are more than 4 years of age, which does not require priming. Nasal powder is dispensed readily in a single dose dispenser, and response should occur in 15 minutes. If no response occurs, it can be repeated. So nasal glucagon was as efficacious and well tolerated for the treatment of insulin-induced hypoglycemia compared to the intramuscular glucagon as well. And these are the formulations approved by FDA. Glucagon Hypokit, Baxi, which is the nasal, Gvoke Hypopen, Zetalog, and Glucagon Kit. And this is the G-Pen 1 milligram subcutaneous injection administered via auto injector. So these novel glucagon formulations aim to simplify the process, reduce the fear of discomfort associated with traditional glucagon injections, and provide better outcomes for individuals at risk of severe hypoglycemia. With the advent of these new treatment, managing severe lows becomes more convenient, safer, and accessible for both patients and caregivers. As Sir had mentioned initially, hypoglycemia is a very important and main concern of treatment of diabetes, not hyperglycemia. It can be lethal, it can cause cardiovascular events, especially in our type 1 patients, and future of and those on insulin and sulfonylureas for that matter. Future of glucagon formulation may also include more personalized, continuous and preventive treatments, helping to minimize the risk of hypoglycemia before it occurs. So now the future treatment would be prevent hypoglycemia by giving glucagon. So that's where the closed loop, the artificial pancreas will come into play. So hypoglycemia is a proven side effect. FDA has approved glucagon, recommended by most of the societies, and the novel glucagon formulations which we have discussed, including Baxi glucagon, biochaperone non-aqueous, and intranasal glucagon, have proven clinical benefits to correct hypoglycemia. Thank you.